from your experiences, have you ever had any issues with accessing mental health services?
There wasn't no straight off the back, hey, you had a traumatic experience, let's get you some help. The lack of elaborating that they have assistance, they can help me. I had a traumatic experience and these are the resources that we can give you was not there whatsoever. It was very judgmental, quick in and out. What was your experience with access to mental health?
So my experience with access to mental health was that I actually did not have an experience. And what I mean by that is no one came to me and said, you should go get therapy. Your daughter should go get therapy. So I wasn't even aware that mental health services were needed or could be accessed. And coming from where I come from, mental health is not discussed at all. I was not informed that I should get mental health until it could have possibly been too late.
Right.
And that's because my behaviors and my reaction to things started to change, and I didn't know what was going on until someone said, Sam, you should probably go talk to somebody. Okay. It was almost a little too late.
Gotcha.
The impact of survivors and even people who may be currently being victimized on receiving mental health services is extremely beneficial. When I did finally start receiving therapy and counseling and my daughter, we started connecting better. Our household became better. I became better at functioning at work. Day to day, it wasn't like depressed and so angry. So those tips and tools and coping mechanisms really helped me now to thrive better. And not just my personal life, but even in my relationships, whether intimate or personal, and work related. So they're definitely beneficial. And with that, it also carries out to my daughter. So her behaviors have changed, even with her individual counseling as well. But it is definitely a benefit. And physically, my body doesn't feel as horrible as it did prior to me receiving therapy.
Gotcha.
How about you?
I think I had a great impact, and I think it's very beneficial for survivors and victims to get therapy, to get any type of mental health resources, whether you're doing some self-care classes, yoga. The coping skills that I received from it has been immaculate on my personal life and my work life. Being able to share my story without feeling judged or embarrassed or shamed. I have grown a lot through my therapy sessions. The thought of going to do therapy and not having it known before to now is just like a huge difference. And I can imagine how much more impact it would have been when I was experiencing my traumatic experiences. But just to heal from it completely, like I'm very much thriving and striving in life from it. So I love it. In my background, cultural, Black people, people of color, there's a huge stigma on receiving mental health services, as well as the mental health in whole, like the anxiety, the PTSD, the depression, the paranoia. That a whole is like, oh, you're crazy, you're going to therapy, oh, you're getting services, or you're doing women healing groups, or etc. Like from my background, that's just not normal. They want you to suck it up and be a strong Black woman and move on with life. And for me, it's like, no, I need to receive these services. I need to go to therapy. I need to break them generational curses and exit out of that stigma or that profound judgment of going to get help. It is okay to get help. It is okay to get counseling. It's okay to get therapy. It helps, makes a huge difference in life. That stigma was huge, especially in my family. But even in my work environment and friends, they're like, girl, you crazy. You don't need to do all that. Like, you've overcome that. You done shared your story. You've been through that. And it's like, yeah, I shared my story because I went to counseling and I got some therapy. But that helped me. That helped my healing, growing process. Like, I'm on a journey and I'm able to share and thrive in that and not be ashamed of what I've endured and elaborate that with my kids as well. So they don't have to endure it, but as well to be able to be like, yeah, my mom was sex trafficked, but she's doing great from that. And because we're going to therapy, like, yeah.
So when I was younger, I heard a lot. Keep people out of business. Don't put our business in the streets. Don't tell nobody anything.
Right.
So in that turn, ended up being secret. So you can't talk to somebody about what you've experienced with you. In our communities, what happens is you hear the moms, I'm not gonna let my child see the psychologist because they're not gonna label my child as having this, and this. So then it keeps trickling. It snowballs back to the communities, and you hear the whole same narrative over again. And then what happens? Our communities suffer because we don't think that we need to get help, and not understanding that our strength really lies in acknowledging our weaknesses. So I'm glad that we're at a place where we like, no, forget y'all, we're going to get help. And we did that, and now we can, you know, be there for others to help them understand like therapy is amazing.
Yes.
So Ronnie, what are some recommendations that you would give to healthcare providers?
I would recommend to healthcare providers a checklist on supporting survivors in universal education. What recommendations would you give them?
If I could give any recommendations to healthcare providers, I would say one, trauma-informed training and cultural awareness, so that they could take their stereotypes and their hidden biases away from the victim and see the person. The other recommendation that I would have would be understanding that mental health and physical health all go together, so that offering that to patients when they come into your office or the hospital, wherever you see them, that you offer it as a holistic package. And my last recommendation would be to have more in-house referrals, so that if you have a person who comes in, for an example, a young lady who's been sexually assaulted, that you're not just giving her, you know, information. All right, you're checked, you do the services that you need and you send them home, but you have maybe a social worker come into the office, a therapist, someone who works with youth who have been abused, come into the office and talk to the person and their family, so that they don't just leave the office or the facility not knowing what to do next. So those would be some of my